around the toenail. It can be pain at the bottom, it can be pain at the top, pain at the corner. They can even see some pus starting to come out or a swelling of the tissues surrounding the nail. So it's usually the pain, especially in shoe gear, that will cause the patient to elicit treatment in my office. Many patients try bathroom surgery themselves at home. They'll try to cut a little V in the center portion of their nail. They'll try to put a cotton Q-tip underneath the area that is growing in to help to alleviate some pressure. But sometimes they can cause more damage than good. And if they're doing recurrent bathroom surgery on themselves, many times they should probably seek a permanent solution or treatment for this to reduce the risk of infection following their own surgical attempts. They can be caused by several things. It can be caused by tight shoe gear. I'll see a lot of children as they come back into the school year from wearing sandals or flip-flops going into last year's tennis shoes or last year's sports shoes where the shoe is rather tight or rather curved, and that can cause pressure on the nail leading to an ingrown. Direct trauma, a patient getting stepped on by a pet family member can cause an ingrown. There can be fungal infections at the nails where the nails get thicker, causing the nail to become to cause more pressure on the sides, again in tighter fitting shoe gear. There can be spurs underneath the nail, something called a subungual exostosis, where the shape of the bone can cause the nail to grow more rounded and become more incurvated on the sides. So the way that this is treated, there is several treatment options. If patients have good circulation and good sensation and aren't at risk for healing, it's very easily treated in the office. What I do is I numb up the toe, but I do utilize some cold spray, so it makes the shot much more comfortable. Once the patient's numb, I just take out a little sliver of the nail with a very small, fine scalpel, and then put a chemical in there that kills the cells that cause the nail to grow out in that spot, so chemically cauterizing the tissue. So that way it never grows back there. You have a permanently narrower nail, but it's just slightly narrower. It still is very cosmetically appeasing. You can still wear sandals, paint your nails, and downtime after that is you have to soak your foot twice a day for about 2 weeks, and then usually a follow-up appointment. And then maybe another week of treatment, soaking yourself at home, and then going back to your activities. Some patients, if the underlying cause is the fungal nail, there's ways to treat the fungal nail with oral as well as topical medications. If patients have very poor blood supply and cannot tolerate healing any sort of surgical procedure, there are lotions, something called urea, which helps to dissolve the keratin in the nail, so that way we can thin the nail, make it more malleable so it doesn't dig in and cause as much discomfort. So most patients can get back to normal activities. It depends upon the side of the toe. If it's on the tibial side, then it might cause a little bit more pressure in shoe gear early on versus what I call the fibular border, or towards the outside of the foot. That usually doesn't get as bothered by being in a shoe. But patients can wear looser fitting shoes, take the insole out of their shoes so there's a little bit more room. I would be cautious with the kids that are on sports teams because you just don't want them to get stepped on, jumped on while they're trying to heal because they'll be a little bit sore. But probably within a week afterwards you can go back to all of your normal activities because it'll be less tender and it'll feel tremendously better having that ingrown portion out.